Bismillahirrahmanirrahim. The next topic of our discussion is Barrett's esophagus. So Barrett's esophagus is actually a complication of gastroesophageal reflux disease, and it is characterized by intestinal metaplasia of lower esophageal squamous mucosa. So what happens in long-standing GERD is that the normal squamous epithelium of the esophageal mucosa is replaced by the columnar epithelium. This replacement of the squamous epithelium with columnar epithelium is known as metaplasia. Metaplasia is actually the transformation of one type of cell into another type of the cell due to chronic stress or injury. So Barrett's esophagus is actually a complication of gastroesophageal reflux disease, and in this case the injury is occurring due to the reflux of gastric acid into the esophagus. The metaplastic epithelium increases risk of transformation into esophageal adenocarcinoma. Since the metaplastic epithelium is considered to be pre-malignant and might also contain dysplastic cells. Dysplasia is present in almost 2% of the cases of Barrett's esophagus, and the presence of dysplasia indicates a pre-invasive tumor. So coming on towards the pathogenesis, the normal esophageal mucosa is squamous epithelium, and in the patients of gastroesophageal reflux disease, there is a repeated injury to the squamous epithelium because of acid reflux. So under the chronic injury and stress, this squamous epithelium undergoes metaplasia and it is transformed into columnar epithelium. This transformation process is known as metaplasia. And once the squamous epithelium is replaced by the columnar epithelium, the condition is known as Barrett's esophagus. This metaplastic epithelium is considered to be pre-malignant. The metaplasia is actually a reversible process, and partial reversal can be seen after treatment of GERD. So when the source of injury is inhibited, the metaplastic columnar epithelium converts into squamous epithelium, which is the normal epithelium of the esophagus. The endoscopy reveals patches of red velvety metaplastic mucosa. As you can see here, this red velvety area indicates the metaplastic region. And within these metaplastic regions, there are also pale patches which indicate normal squamous mucosa of the esophagus. Moreover, the metaplastic segment of the esophagus could be either a long segment or it could be a short segment. It is known as long segment once its size is greater than 3 centimeters. And if the size is less than 3 centimeters, it is known as short segment metaplasia. The histological picture reveals metaplastic columnar epithelium adjacent to the squamous epithelium. As you can see in this histological picture, there is squamous epithelium and then there is columnar epithelium. This columnar epithelium is actually the metaplastic epithelium, and within this epithelial layer, goblet cells are also present. Goblet cells are actually the mucus secreting cells which are present in the intestine. So the presence of columnar epithelium and the goblet cells indicates intestinal metaplasia, since the goblet cells are present in the intestine. The metaplastic columnar epithelium and the goblet cells are the hallmark for the diagnosis of intestinal metaplasia in the esophagus or Barrett's esophagus. Moreover, the metaplastic columnar epithelium could also indicate dysplasia. The dysplastic cells are characterized by the immature atypical cells which have a high nuclear to cytoplasm ratio indicating abundant cytoplasm. There are increased mitotic bodies and there is failure of cell maturation. The dysplasia is considered to be a pre-invasive lesion. This Barrett's esophagus occurs in the background of gastroesophageal reflux disease. The patient might have the symptoms of gastroesophageal reflux disease, which include heartburn, burning sensation in the stomach, and sour taste in the mouth. Almost 10% of the GERD patients have Barrett's esophagus. Therefore, almost all the patients presenting with the chronic GERD must undergo an endoscopy for the examination of esophageal mucosa. The diagnosis is established on endoscopy and the biopsy. The endoscopy reveals red velvety patches of metaplastic mucosa, and the biopsy also indicates the presence of columnar epithelium and goblet cells. Moreover, the biopsy sample is also assessed for the presence of dysplastic cells to rule out risk of adenocarcinoma. Since metaplasia is a reversible process, partial reversal can be seen with proton pump inhibitors and lifestyle modifications to treat gastroesophageal reflux disease. The grave complication of the Barrett's esophagus is the esophageal adenocarcinoma. So this brings us to the end of discussion about Barrett's esophagus. If you have any questions, do let us know in the comment section. Thank you.